In Your Health Matters this morning, we take a look at a common problem that many people have but can sometimes be hard to diagnose.
I worked with photojournalist Bob Rhodes to introduce you to SI fusions and how this simple procedure helped change one woman's life. For Dolores Thorman of Boyne City, it was an agonizing pain for the past 5 years that started affecting her daily life.
Just riding in the car, long distances, just getting into my car, because it was a discomfort, stabbing pain getting into the car, just getting up and in out of a chair.
Thorman was having severe pain in the right side of her lower back. She went through physical therapy, even tried a chiropractor and pain injections. Nothing seemed to help.
Mowing the lawn. I wasn't even able to do those things. Mowing the lawn, working in my flower bed. I want to be able to go out and work in my garden and not have to have my husband come out and help me get back up.
She basically wanted her life back and finally had a CAT scan done, which led her doctor to realize she was having a problem here in the pelvic area, in what's known as the SI joint. The solution was a non-invasive form of surgery.
The SI joint is the joint where the spine connects to the pelvis. So essentially, all of your upper body weight connects with your pelvis through that joint. And it can get arthritis just like your hip, your knee, or your shoulder. In those joints, you usually replace the joint, but in the SI joint, you don't replace it, you fuse it, where you make the pelvis and the spine become one bone. So there's no motion in the area. What people have is they have a lot of pain because there's motion, and if you eliminate the motion, you eliminate the pain.
Dr. Scott Gross-Close is an orthopedic surgeon at Munson Medical Center. He recommended that Thorman have an SI fusion done.
It's a relatively minimal procedure. It's minimally invasive. It's a small incision. It's an overnight stay. So once they have one side done and they see the benefit, then they all come back for their other side to be done. In general, it's two populations. It's usually younger women that have never had an accident, they've not had a trauma, and then anybody that's had a pelvic fracture before or an injury to that sacroiliac joint.
Dr. Gross-Close says the SI joint issue is fairly common and sometimes it can get overlooked.
The SI joint is something that a lot of physicians don't think about. A lot of physicians will say, well, you have back pain, it's your hip, and they really don't think about it because it's not really a traditional source of discomfort in some physicians' eyes. But I've seen many patients over the years that have had 10, 15, 20 years of pain. They go and see 6, 7, 8 physicians and they give up.
He did the surgery back in January. My recovery time, I was back to work April 2nd of this year.
For Thorman, she says she feels like herself again after several years of pain and says people simply need to listen to their bodies.
Maybe look into this. It's a quick check. They just do that CAT scan, give you that epidural injection. If you have relief and no pain, then you might be a candidate for that SI joint implant. You'll have your life back.
And definitely a very simple fix to a huge problem. Dolores, who I spoke with, said that she feels like she has her life back.
Good for her.
And it went so well, actually, the SI fusion, that she has scheduled another surgery for her other side, and that's scheduled for July 25th.
Now, if you would like more information about the procedure at Munson Medical Center, we have posted a direct link on our website, upnorthlive.com.